What does the future of suicide prevention look like to you?
I think there's a very bright future for suicide prevention. I think that it definitely faces challenges. You know, this is an area in which there are definitely limited resources, and that's across public health, that oftentimes there are challenges in getting resources for particular programs because there's, competing interests, where, there may be a disease or a health condition here that needs some attention. You've got other ones that also need some attention. So there's definitely some of the challenges of resources. What's been shown, and I think this is part of what the research is doing, is much more evaluation now is going on of programs, scientific, rigorous evaluation where we can really look at outcomes and be able to demonstrate this program is really showing a decrease, or it's able to show that this program doesn't work, and so we're able to modify or do some other changes to that particular thing. So I think a strength that is now happening is much more outcome evaluation of programs. I think we're also improving our surveillance systems. Many states had to rely primarily on deaths and death certificate data, which have very limited information regarding circumstances and where the prevention activity might focus. But as we've expanded things like the National Violent Death Reporting System that puts together several different data sources, has information about circumstances on it, there are programs and states that have been able to react to that information, be able to say, oh, we need to actually focus on a different population. Or here's a risk factor. For instance, we found in some states that intimate partner problems are one of the leading precipitating events for suicidal behavior. Well, they are able to focus some of their efforts in that area. And so there are definitely some things that we've seen looking at non-fatal suicidal behavior that as we expand some of our surveillance systems, we're able to identify those that have made suicide attempts, because the research has also shown us that that is one of the groups that has that greatest risk of dying by suicide, those who have made previous attempts. So now how can we intervene with those that have made attempts, and then how can we prevent those attempts from happening in the first place?